So thank you very much, Jay. Thank you for inviting me to say a few words for a meeting which you have put extremely important efforts, and you've been working hard over the past few months, and I know that you have interacted a number of times with me. So welcome all to Dundee for this very prestigious and important meeting in head and neck cancers. And I hope you would enjoy this meeting and take lots of new knowledge and skills which you can then use in your clinical practice. Now, this meeting is hosted by Dundee, and Jay and the team have put up a very impressive program, including a significant strides in clinical services research and teaching, which I'm very pleased and proud of it. So the Dundee is becoming a source of emanating the knowledge, which is not new to Dundee because this place has been at the forefront for a number of things. If you look at historic perspective, this place was famous for jute, juice, and journalism, but that has more or less died, as it happens in most of our clinical practice. The things we start with, perhaps we don't carry on. But the Dundee is still making a huge number of contribution, much higher than what its size would suggest on the map. For example, the Dundee Medical School has been ranked a #1 medical school ahead of Oxford and Cambridge in a recent university ranking. In 2014, the REF, which is an exercise to assess the quality of our research, whether that research is outstanding in terms of world contribution, we were rated as #1, again ahead of Cambridge and Oxford. And given the size of university, this was a remarkable achievement. And we continue to be ahead in research and teaching. This place has a number of attractive sites to see, and all of you are invited to come to Dundee. Whenever you get a chance to visit this place, you would certainly see our new DIHNE museum, which we have inaugurated a couple of years back, and has been a huge attraction for people to come from all over the world and see that place. We are very good. There's a university which has dedicated program in video gaming and computer. So we are #1 in the world, and there are a huge number of patents which we contributed to the field of computing and video games. Similarly, Dundee has been at the forefront of medical research. We were pioneer in minimally invasive surgery. We were the first one to start minimally invasive surgery in general surgery, and certainly that has now spread all across the world. With this conference and the contents which have been put together, I have no doubt that you would learn a huge number of things and you would update yourself. These meetings are extremely important to keep yourself abreast with the latest technology, because when I was a medical student, the things I learned are historic now. So I moved on to new fields, and it's true for all the specialties, including head and neck cancers and services. So I expect and I hope that you would take a number of things from today and try to think and reflect on your practice and bring up some new things which would certainly benefit your patients and public. And that's what we are here as doctors and as surgeons. And I wish you all the best for the rest of the meeting, and I'll hand over back to Jay. Thank you, Jay.
Thank you very much, Ghulam, for your kind words and the support. That's great.